what I want to do is spend a moment and talk about the most confusing aspect of healthcare, and that's symptoms. Why are symptoms confusing? Well, if you think back to the old statement you've heard, if it ain't broke, don't fix it. That's how we've been taking care of our health in the past. Unless we have a symptom, we don't do anything about it. Matter of fact, the entire healthcare system is basically a symptom-based model. You know, when you don't go to a doctor to stay well. You go to a doctor when you're already sick. And when you see symptoms, most people think if I take care of my symptoms, I've taken care of the problem. Well, a symptom is just the body's warning sign of an underlying health problem. A symptom is actually the result, not the cause of health problems. It's a result of a health problem. And what we know is our healthcare system became chronic disease management when it doesn't ever try and fix anything. All it tries to do is manage symptoms. I like to think of it as a chronic disease management system, whereas people actually don't get healthy, they just manage their symptoms day to day. Let me give you an easy example. If a person throws up, is that good or bad? Well, the answer to that is the cause. If the cause is I just ate some raw sushi that was mismanaged and now I need to get that out of my body, throwing up is the best thing I can do. It's actually healthy for me to throw up unhealthy food. Now, if I ate the sushi and I now start throwing up out of control and there's nothing wrong with the food, then there's something else wrong with my body. So again, if I just start taking something to manage and stop throwing up, in the first example, I'm going to get worse. If I cannot throw up the bad sushi, guess what? I'm going to continue to have more and more bacteria and get sicker and sicker. On the other hand, if I stop throwing up and I was healthy, we never actually get to the cause. That medication, whatever drug that we're told to take by the TV commercial, is not actually going to solve anything. It's going to prolong the problem. It's going to actually worsen my health overall. So we know that drugs treat symptoms. Doctors search for symptoms. We're going to search for causes. And we know healthcare can have three major categories of underlying causes. And we look at toxicities and deficiencies in our office. Because, hey, you could have a headache because you didn't have enough water. You could have a headache because you ate something that wasn't good. We know stress and hormones can cause problems. Most ladies will tell you if their hormones are out of balance, they're going to have some different headaches. They might have different symptoms in there. And stress, major cause of health issues that cause symptoms. And we know the biggest, most important, most unrecognized, undocumented cause of symptoms is nerve, stress, compression, joint and nerve health issues. And in our office, we're always going to look for what is going on with the cause, meaning are there nerves that are pinched, irritated, choked? Is there miscommunication from wellness signals that are trying to get from the brain to the body back to the brain? That's what we want to know. So our goal here is not symptom management. When you come in, as you get healthy, your symptoms are going to go away. But I don't want to have no symptoms and then a healthy body. What I want to have is a healthy body so there is no symptoms. We look forward to the best health you've ever had at Brackney Chiropractic.